Let us see omentum. Omentum is a fold of peritoneum which suspends the stomach or which is attached to the stomach. You know that. Okay, we have two types. Two are there, that is a lesser omentum and a greater omentum. Lesser omentum and a greater omentum. Greater omentum. Okay, so we have already stomach. Okay, this is the lesser curvature stomach and this is a greater curvature stomach, the part of the peritoneum. And you know that here what structure is there? Can you tell me what structure we can see? Here we have the liver. Liver, the peritoneum which is connecting the liver to the lesser curvature. So here we have the porta hepatis, from the porta hepatis to the lesser curvature stomach. This is the lesser omentum. So here is the lesser omentum and this is known as the greater omentum. Greater omentum. Let us see the attachment of lesser omentum. Lesser omentum is a fold of peritoneum which it's a double layered layer of peritoneum that connects the liver to the stomach. It has got two surfaces. There is an anterior surface and posterior surface, and it has got a margin over here. So this margin is the right free margin. Right free margin. Okay. So what is attachment? Superiorly, you can see that superiorly where it is attached. Superiorly, that is a lesser omentum is attached to the liver. Attached to the liver. Where exactly it is attached to the liver? It is attached along the border of porta hepatis. Border of porta hepatis. Porta hepatis. And where exactly inferior it is attached to the lesser curvature stomach as well as the first part of the duodenum. We can divide the lesser omentum into two parts. Hepatogastric ligament. Hepatogastric, that is from the hepatic liver to the stomach. Hepatogastric ligament, and this part called hepatoduodenal ligament. Hepatogastric ligament and hepatoduodenal ligament. Hepatogastric and hepatoduodenal ligament. Okay, then what are the contents of lesser omentum? Contents of lesser omentum. I told it has got a right free margin. Right free margin. Okay, so this is the right free margin. So three structures are related to the right free margin. So we have three structures are there. We have portal vein, hepatic artery and bile duct. Bile duct. So these are the structures. Normally we say it as the BP high. BP high. These are the structures related to the right free margin of lesser omentum. What are they? Bile duct, portal vein and hepatic artery. Bile duct, portal vein and hepatic artery. In addition to that one, two more structures are there. Along the lesser curvature of the stomach, we have two structures. Can you tell me? We have the left gastric artery over this area, and here we have the right gastric artery. This is the left gastric artery and this is the right gastric artery. So these are also the contents of lesser omentum. Then we have some gastric nerves also. Gastric nerves. Okay, that is the lesser omentum. Now let us see the greater omentum. The greater omentum is a double-layered fold of peritoneum which is hangs from the greater curvature of the stomach. Greater, here is the greater curvature stomach. Okay, then it's a double-layered fold of peritoneum. It has got total 4 layers are there. Let us see how these 4 layers are formed. It's also known as the gastrocolic omentum. Greater omentum is also known as the gastrocolic omentum. Gastrocolic omentum. Okay, so here we have already seen the reflection of the peritoneum from the anterior abdominal wall. You can see from here the anterior abdominal wall, peritoneum going upwards here, reflect over the diaphragm, going to the liver here, porta hepatis. So this is stomach, going to the stomach. The same here also we have. This is the greater curvature. We have the greater omentum. So This is the greater omentum. How many layers or walls are there? First layer, second layer, third layer, fourth layer. Here what happens, from the greater curvature of the stomach, the first and second layer runs downwards and forwards, reflected over itself, runs upwards and backwards. So here the first layer become the fourth layer, second layer become the third layer. Okay, what happened to third layer? Second layer become the third layer. Third layer runs out upwards over the transverse colon, and here is the transverse mesocolon, then blend with the transverse mesocolon, then it runs upwards in front of the duodenum and pancreas and going back to the posterior abdominal wall. Then what about the posterior layer? There's a fourth layer. Fourth layer runs over below the transverse colon and forms the transverse mesocolon. Okay, then it reflected back onto the posterior abdominal wall. Okay, so that is the reflections or the folding formation of the greater omentum. So this is how the status of the greater omentum. Then what are the contents of the greater omentum? You can see, so here just like the lesser curvature, so here the greater curvature, we have two blood vessels are there, mainly two arteries, left gastroepiploic artery and the right gastroepiploic artery. Okay, epiploic vessels are right and left epiploic vessels are there, and in addition this structure or the greater omentum consists of milky spots. That means large number of collection of macrophages are there. Okay, it's access, it helps in the storage of fat. It's also known as the policeman of abdomen. Why it is called policeman of abdomen? Because it's a free structure hangs down from the greater curvature of the stomach, right? So this particular, as the large amount of macrophages are present over here, it has a role in spreading the infections. Okay, if there is an infections in the peritoneal cavity, so this particular greater omentum move towards the site of infection and seals off the structure so that it prevents the further spread of infection. That is why it's called as the policeman of abdomen. And what are the parts of this greater omentum? We can see this is the greater omentum, the uppermost part of the greater omentum here between the stomach and the spleen. This part forms a ligament that is known as the gastrosplenic ligament. So this is a gastrosplenic ligament. Okay, and from the stomach to the diaphragm, this part is known as the gastrophrenic ligament. Now let us see mesentery. You know what is mesentery? So mesentery is a fold of peritoneum suspending the small intestine. So here in this diagram you can see small intestine, and this is the mesentery. Okay, so mesentery, I told you it's a fold of small intestine which is suspending the small intestine from the posterior abdominal wall. It has got two parts are there. Okay, so this particular part, the border which is attached to the small intestine, so that is known as the attached free border. What is that? Free or intestinal border. And the other one is the attached border, or the root, Okay, so here you can see the free border, and here where it is attached to the posterior abdominal wall, that is known as a root of mesentery. Root of mesentery is 6 inches long, and the free border is 6 meter. Remember, 6 meter, 6 inch and 6 meter. Okay, then I told you the root of mesentery is attached to the posterior abdominal wall, whereas a free border is attached along the intestinal border. Okay, now let us see the root of mesentery. Though the root of mesentery is the attached margin of the mesentery, it is obliquely attached to the posterior abdominal wall. Okay, then from the root to the free border, okay, when it is coming downwards obliquely, it crosses some structures. So here in this picture I already made a picture. The highlighted area is the mesentery. Okay, root of mesentery is crosses some structures. Let us see what are they. You can see here we have the duodenum. This is the duodenum. Okay, and here we have the abdominal aorta. Aorta. This is the inferior vena cava. Inferior vena cava. This is the psoas major muscle. Right major psoas major muscle. This is the right ureter. Right ureter. Right ureter. Now let us see the structures closed by root of mesentery. So here we have the third part of duodenum. Here is the first part, second part, third part, and fourth part. It crosses the third part of duodenum. Then comes the abdominal aorta. Then it crosses the inferior vena cava. Then it crosses the ureter, right ureter, and finally to the right psoas major muscle. Okay, you can see the duodenum, abdominal aorta, third part of duodenum, abdominal aorta, inferior vena cava, ureter, right ureter, and right psoas major. These are the structures closed by root of mesentery. Structures closed by root of mesentery. Okay, to remember this one, there is an interesting mnemonics is there. Let us see what is that. Doctors are very useful persons. And interesting. Doctors are very useful persons. D stands for third part of duodenum. A stands for abdominal aorta. V stands for inferior vena cava. U stands for ureter, right. P stands for psoas major, right psoas major. So these are the structures caused by root of mesentery. So it's also a viva question asked for short note in examinations also. Okay, so doctors are very useful persons. D for third part of duodenum, A for abdominal aorta, V for inferior vena cava, U for ureter, right, and P for right psoas major. Okay, that is the mesentery.